Hello everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Jawahir Baraka, a sixth year medical student at Qatar University and the chair. Thank you so much. I'm glad actually to be the chair of the student program for the All Together Better Health Conference. And I've been the president of the Interprofessional Education Student Association here in Qatar for 5 years. I would like to extend my warm welcoming and greetings to each one of you at the 11th edition of the All Together Better Health Conference. It's truly an honor to be standing here in front of such a diverse audience today. Our conference is a celebration of solidarity and the essence of interprofessional education and collaboration. I'm thrilled to introduce the highly anticipated Interprofessional Education Case Challenge today, a culmination of skills, innovation, and teamwork. This year's event holds a special place in our hearts as participants and even organizers, as young minds from 32 countries, from diverse backgrounds, coming to share their experience and knowledge to participate in such a unique challenge. Their mission to showcase their collaborative skills by presenting the most effective management plan in this challenge for a 5-minute presentation case and test their abilities to work within a team under pressure. This year's event, as we said, holds a special place in our hearts, and together we take pride in emphasizing the significance of a cross-cultural collaboration in healthcare. So the healthcare team challenge, or the interprofessional team challenge, actually is a 5-minute presentation for groups that are pre-specified. They were given a challenging case to have a management plan to be presented today in 5 minutes. There is going to be, we will test them under pressure. They will be having a question to think about in 2 minutes and answer in 3 minutes. Today, these teams will have the opportunity to demonstrate their skills before a distinguished panel of judges whose invaluable contributions will undoubtedly shape the growth and development of our students. I'm delighted to introduce our esteemed panel of judges. So first of all, we have Prof. John Gilbert, who's the founding and principal professor of Emeritus, College of Health Disciplines, University of British of Columbia. Thank you, Dr. John. We have Dr. Ahmed Hankir, who's a senior research fellow, Center of Mental Health Research in association with Cambridge University, and assistant professor of psychiatry at Western University. Thank you, Dr. Ahmed. We have also Dr. Ruwaida Al-Maaita, consultant for Her Royal Highness Princess Mona Al-Hussein for Health and Social Development, and a former Senator and Minister of Health, Education and Scientific Research, board member of Jordanian Nursing Council, and professor at the Faculty of Nursing at Jordanian University for Science and Technology. Thank you, Dr. Ruwaida. And lastly, but not least, we have Dr. Nabila Almi, the Dean of College of Nursing at Qatar University. Thank you, Dr. Nabila, as well. So with great enthusiasm, let us embark on this challenge where knowledge knows no borders and collaborations know no bound. I eagerly anticipate witnessing the incredible ideas and solutions that will emerge from this competition. Thank you, everyone, for attending, and I wish all the groups best of wishes. And I would kindly ask group number 1 to please head to the stage. So group number 1, here are the lists, as you can see, from all around of the walls, from Qatar, Japan, Switzerland, England, and Qatar as well, from different universities. So I keep the stage for you guys. I will repeat again for the audience that each group has 5 minutes to present. The group, you are going to be hearing the first bell at 1 minute, the second bell at 4.5 minutes, and at 5 you will hear 2 bells ringing. Then the other bells ringing bells will assume once you have the questions in hand. The stage is yours.
Hi, good morning, team. How is everyone doing?
Hello.
So I believe everyone's here, right? Okay, we can start our meeting today then. So our patient is Mr. Ali. He is 68 years old, Egyptian male, diagnosed with acute ischemic stroke. So I believe some of you guys have met Mr. Ali and have updates for the team? Right.
Today, the patient is doing well, vitally stable. Corina, the wife did have some concerns about his limited movement of the right arm and speed.
I see. Since he has already some function in his right arm, he has a good prognosis to get good arm function back. We also had the first mobilization this morning, and that went very well as well. However, I think he would benefit the most if he could go into an inpatient rehabilitation after his hospitalization. Or what do you think, Hannah?
Our aim is for him to develop as much independence as possible, getting him back to his teaching career. So I agree that he would benefit from inpatient rehabilitation. Given his reduction of function in his right arm, Mr. Ali and I have learnt new ways to carry out basic tasks, such as getting dressed and brushing our teeth. In the future, home adaptations may be made. From the SLP's point of view, what is Mr. Ali's management plan?
So as an SLP, we have done an initial swallowing assessment and we have concluded that Mr. Ali has moderate dysphagia. Our goal for Mr. Ali is going to be that we want him to eat independently and discontinue his nasogastric tube. So we will be providing exercises that will help him improve his speech as well as swallowing functions. We will be going to reassess him in some time. Meanwhile, I would like to point out that during our assessment, we found that Mr. Ali has dental caries.
Yeah, great that you brought that up. I actually talked to the dentist regarding this, and he said he will be visiting Mr. Ali today, and he's going to update us regarding his plan. Fazia, that reminds me, what are we doing with his medication since his sugar is not well controlled, and as Maimouna mentioned, he does have difficulty swallowing?
Yeah, I have reviewed his medication and we can continue those with a few adjustments to the route. We will also start him on low-dose aspirin, so to reduce the risk of clot formation. And also, I wanted to know what his lipid levels are like currently.
Right, so we did labs for him. His LDL is actually elevated, around 192, while his HDL is low, 38.
Okay, so we want to increase his atorvastatin to 40 milligrams then.
Right, makes sense, yeah.
The wife was also concerned about his mental health since the patient expressed not wanting to leave.
Oh, okay. So what we're going to do is we're going to assess him for post-stroke depression. And we'll assess whether he wants to do this behaviorally or if he wants to use medication. I've got a question. Does he have any spiritual authorities or religious authorities that he wants to include?
I'm not sure. I will get back to you on this.
Thank you. Thank you. So we know that malnutrition is a risk factor of stroke. How does this affect his diet or nutritional intake?
Yeah, I think that is a great point. We will definitely factor this into our plan.
Thank you. Yeah.
At the moment, his BMI is about 31, a little bit on the B side. At the moment, what we could do is add pureed and thickened drinks, as the patient has a nasogastric tube. So he's also a smoker, which as a result, he needs a lot of counseling and definitely exercise.
Right, so I believe those are all the updates from the team. We have agreed on a management plan. Now, Seki and I were just going to go to the patient, tell him the management plan from our side, and see what he thinks. Thank you, everyone.
So while Mr. Ali and Ms. Fatima are talking about their management plan, we hope this case has brought some attention to stroke, which is the leading disability worldwide. The social determinants of health that increases risk of stroke is lack of education, income, lack of healthcare, and socio-economic factors. One of the major risk factors is obesity. And Doha is seeing rise in obesity with 35% of Qatari population actually being affected by obesity. Prevention is needed at every level of care according to the Qatari guidelines, and collectively we've agreed on some prevention. So primary prevention, we've said we want to promote healthy lifestyles, so reinforcing smoking cessation. Second prevention, we want to include screening programs for hyperlipidemia, diabetes or hypertension. The tertiary is reducing complications of stroke. The effectiveness of these programs can be assessed by surveys and community feedbacks. We'll now go back to Mr. Ali and see what they have to say.
Right, so that was the management plan. Are you guys happy to go ahead with it?
Yeah, we're happy, but I was just a bit concerned about the cost.
Yeah, so regarding the cost, Saki over here is going to connect you with a social worker to figure that out for you. And we will be following Mr. Ali up in the clinic after discharge just to make sure he's doing good. Do you guys have any other questions, concerns?
No, thank you so much.
Thank you.
The question is, Mr. Ali came across several articles that magnify the complications and severity of stroke, particularly in patients who suffer from chronic conditions like him. Additionally, he read about the risk of stroke reoccurrence. Hence, he started to experience episodes of panic attacks, during which he develops tachycardia and extreme fear of death. He is now vitally unstable. How would you address this?
2 minutes, start now.
That we need to address specifically. Extreme fear of death means he's suicidal.
Okay, so provide him support with family-centered care.
Suicidal.
I think it's better if two people answer.
Both of you come.
Yeah, I'll help you. You start first. Yeah. But what am I going to cover? Am I going to cover?
Okay, so we have discussed amongst ourselves and we have come up with a plan. So currently, since Mr. Ali is vitally unstable, as mentioned, we will try to stabilize him first. Once he is vitally stable, we're then going to be moving on to discussing his main, let's say, concerns. Why does he have this fear of death? Explore a bit about why he is having such thoughts. After we have discovered his thoughts, his issues, we're then going to be moving on to the mental health side, which now will be answered by Maya.
So mental health is very important for our patient. There is lots of, we can include support sessions for him, include
family-centered care. And we do want to reassure him again and again because according to our management, he will be on diet control. We want to be making sure that he's compliant with his medications. We do want to be following up with him and making him aware that yes, he's doing clinically well. in addition to providing him mental health support from a psychiatrist if he wants to be seen by a psychiatrist. And as well as we'll be involving the wife in the role and his family in the role to helping him calm down during such panic episodes and how to help him, as well as informing Mr. Ali himself how can he calm himself down, teaching him breathing exercises and what other ways of controlling.
And also just to get to the root of why he's feeling this extreme fear of death. And so we can tackle it from there if we know the root cause of why he's feeling that way.
Right, thank you.
Thank you for your question.
Thank you so much, group number 1. Thank you so much. We'll now move to the judges' feedback. Dr. John Galbert, do you wish to start? Dr. Ahmed Hankir, would you wish to? Just make sure it's up. Can we check the arguments?
Can you hear me now? Yes. So congratulations. That was an excellent team effort. So when I'm providing feedback, I think of the WWW and EBI. So what went well? I'm a psychiatrist, so I'm happy that you emphasize the importance of mental health. There is no health without mental health. And I think it would have been even better if maybe you expanded a bit more on the spirituality and the cultural dimension and what roles, if any, they can play in not only health promotion, but prevention of developing health problems. But otherwise, congratulations and well done.
Thank you for your feedback.
Thank you.
Dr. Ruwaida.
Congratulations, actually, you've done a great job. And I had, the same comment, actually, to emphasize the social as well as, the mental, situation of the patient and the family. And also the coping of the family, of the family. And later, I think the second part of your work was about, what you're going to plan for community, something like that. Maybe you do not have the time actually to talk more about it, but you've done very well. Thank you.
Thank you.
Hello, thank you. I think you did very well. There are some comments maybe that will help you in your future when you are taking care of a patient as a stroke. Usually stroke is looking at as 3 phases. There's acute phase, post-acute, and rehabilitation. So when you are planning the care for the patient, you have to look at these phases the patient will go through. Each phase, it has a way of management, and each one of you is very important. I'm glad that you included many multidisciplinary team with you to take care of the patient. In the acute phase, usually, there is other discipline is involved. For example, he had a problem with cardiac problem. So cardiologists could have been seeing him. Also, he's a diabetic patient. So from internal medicine, somebody should have seen him to manage the case. It's good that you included the psychiatrist to see him. That's good. But when it goes to social worker, if they talked about more what is available for them, because he was so depressed that he lost his job. He was afraid he's losing his job. And because the wife also have to take care of him and financially, so there is who will support them financially as a breadwinner. So that's an area. Usually in the organization, there is other way of dealing with this situation. Other organization financially can support the family, or there is respite care if the wife cannot take care of him because she have to work. There's some other services provided in the community. So that's what I wanted to add to what you did. Thank you very much.
Thank you.
Well, for the first time, this is pretty good. But I just have an observation. I mean, I agree that you kind of walked through the case and given us a lot of very useful information, but I do agree with my colleague at the end of the table. Got to think about that. But you know what? If you're going to do teamwork, First of all, I would pull those chairs a little bigger into a little smaller circle and look at each other when you're talking. It's very important that you can read your faces so that you understand what it is that I got the impression that you were talking into space, okay? And that space, that's not where we're at. We want you to talk with each other and to each other. Really important. And body language is absolutely important because it indicates to us, indicates to me, whether or not you're really interested in being in this, you know. I've been at discharges where clearly people are not in the least bit interested in the patient. They're playing around on their cell phones. You have to watch it, okay? So make sure you're looking at each other. You're not looking out there. You know, that's a nice lot of people. They're going to clap for you anyway. But look at each other. Make sure that you're really getting what it is that other health professional is giving you that's new and important, et cetera, that you can learn from. But otherwise, thanks.
Thank you.
Thank you so much, Group 1. Now I would like to ask Group 2, please, if you can step to the stage. So here is the Group 2 members, mentored by Dr. Iqra. So as you can see, also we have variety of countries and professions.
They said they would provide. Yes.
One more chair. Two more chairs, please. No, other than those, two more chairs.
We should also hold the mic.
offering you Mr. Ali, a 68-year-old male patient with sudden onset of stroke-like symptoms about 15 minutes ago. No known allergies, but prior history of diabetes. The wife is on her way. Do you have any questions?
No, thank you so much. We'll take over.
I have completed the vital and I'm waiting your request for lab assessments.
Thank you. Hi, Mr. Ali. This is Yaman, the emergency department doctor. We are suspecting that you might have a stroke. We would like to order some investigations and do a CT scan for you. Would you consent to do that?
Yes.
Thank you.
Hi, radiologist here. Mr. Ali's CT came back, which showed a hyperdense left middle cerebral atrial media.
So since the diagnosis of acute ischemic stroke has been made, let's start the stroke protocol.
So in that case, let's begin IV alteplase immediately and we will withhold dabigatran for 24 hours.
Hi, biomedical technician here. The results are back for Mr. Ali. The patient shows metabolic acidosis alongside elevated HbA1c levels.
So according to the result, I will start a half oxygen and I will repeat the VPGs in 4 hours.
The patient's blood has been sent for MRSA screening.
Today, we are here to discuss a patient, Mr. Ali. Vitals are stable and no active issue.
According to the state guidelines of Qatar, aspirin is recommended for the long-term prevention of stroke. Dabigatran has been resumed.
So my understanding is that statins may increase the risk of bleeding in the patients with stroke. So should we stop it?
That is a really good point. Although according to the guidelines, as Mr. Ali was already on atorvastatin before his admission, we should continue it to prevent the risk of ischemic strokes, ischemic attacks.
Yeah, makes sense. Thank you.
After examination of Mr. Ali's calluses, we request a Doppler for the foot and refer to podiatry.
Mr. Ali is still on his nasogastric tube, so his intake is adjusted according to his diabetic levels.
We have scheduled the FEES test for next week to assess his swallowing, and we're also doing voice therapy for his communication.
For now, keep him on room air.
We are working in collaboration with physiotherapy, occupational therapy and respiratory therapy to improve mobility as well as lung capacity.
In the meantime, we are educating the Mr. Ari's family about good dental hygiene.
After reviewing the financial strain that is placed on Mr. Ali's family, we are working with Mr. Ali's insurance company, and we're talking to local charities as well.
I have contacted Mr. Ali's family on a weekly basis regarding Mr. Ali's condition and referred to a diabetic educator. The family has also been contacted with Mr. Ali's consent, and his daughters will stay in touch via video call regarding his discharge. Mr. Ali and his wife will be joining us soon for our meeting. Good afternoon, Mr. Ali. This is the team. Please let us know if you or someone else requires a translator.
Yes, please. Thank you. I would like to request an Arabic translator for my wife. She can't speak English.
راح أقوم بالترجمة في حالة وجود أي مشاكل، وفي حالة أي شيء ممكن أساعد فيه أنا موجود.
شكرا.
هل عندكم خدمات متوع حق رقيع الشفاء؟
نعم، نقدم خدمات المطوع بالتعاون مع وزارة الأوقاف.
This slide displays the variety of multidisciplinary professionals that have come together with a focus on delivering patient-centered care. 1 month later, Mr. Ali presents with low mood and is in a distressed state.
So I'm the psychiatrist, this is the team psychologist. We are worried about your mental condition. Would you feel willing and open to discuss your concerns in front of your wife?
Yes, I'm very upset. How will I ever work again?
This is normal after stroke. It is called post-stroke depression, so you don't need to feel ashamed about it.
We have many therapeutic options that we can provide you with. For instance, there is a pill called fluoxetine. Would you be open to giving it a try?
Oh my God. Yes, I will try it for now.
And what about you, Miss Fatima? How are you
I'm
feeling?
overwhelmed with all of this. I need help, please.
It's brave of you to voice these concerns. There are different programs to support you, like the caregiver hotline.
Thank you.
The Stroke Outreach Programme, carried out by public health and safety officers, combines multidisciplinary teams to promote and improve public awareness of stroke, prevention and the management.
As a team, we have came up with 4 concepts. The first one being more outreach events. This is where we hand out leaflets to the public and make them aware about regular blood pressure monitoring to create public awareness. The second is the school awareness programme, so teachers will lead sessions to teach students regarding the stroke signs so that they can be aware to recognise it in community.
The third is billboards, as they are an eye-catching way to ensure concise information is presented on a large scale to patients. The last concept is social media campaigns, which incorporate various media platforms, including Instagram and Qatar radios, using pop-up advertisements and professional talks.
Over 23 professions spanning 5 countries joined forces to serve the patient. I can't.
But
together we can.
Okay, so our question is, Mr. Ali continues to struggle as he grapples with the complications of his deteriorating condition. His struggles are compounded when a devastating earthquake rattles his city, creating new challenges for both his personal health and the community at large. Following the earthquake, city services are disrupted heavily. Mr. Ali is deeply worried about the availability of his medications and the continuity of services in the clinic. What contingency plans can you suggest for implementation to ensure that Mr. Ali and other stroke patients in the community continue to receive adequate care in the immediate aftermath of the earthquake, including anticipated medicine shortages, exacerbated health risks, and the psychological impact of the catastrophe?
Social workers to provide other charities. There must be like Qatar charities.
What do you think?
Regarding medication, we can make sure that they have a stockpile of medication.
Yeah, so we can give them so you wouldn't have that. No, it says here immediate aftermath of the earthquake. So we'll say medication.
And also make sure that his caregivers and his family are careful because probably they are worried about the earthquake
So
and
we'll
maybe
give
some other people.
support hotlines as well. Support hotlines.
So the pharmacist should educate him about the participate him because he might stop.
In pharmacists here at Adherent, remember we need to say as a team, as a healthcare team. Yeah, case managers. Medicines. Are we going to say that we can give him like a couple months supply? Yeah. Repeat, have it on my
He's also worried, so should we mention the psychiatrist?
Yes, I agree.
So worried, could have video or phone call with psychiatrist. Video. Can someone else say this though? I'll start if someone jumps in.
You can go ahead. And we can just continue.
Psychiatrist, so have medication has been approved as the biggest supply.
Your answer, please, group 2.
Thank you.
Yes, your time starts now.
Our answer as a team, we would come together to reassure and show empathy firstly to the patient. Mr. Ali does have a private nurse, so case managers and social workers will work closely with the private nurse to support Mr. Ali. In terms of the pharmacist and the medications, we could put Mr. Ali's medications on repeat prescriptions, give him enough supply. We would encourage Mr. Ali to have adherence to his medicines and to discuss the importance of that. We would offer Mr. Ali phone calls with the psychiatrist if he feels worried, or just to let him know that as a team we will support him and be there for him in this time.
For example, with the anticipated medicine shortages, we could, it is an anticipation, we could have more stock of the regular medication that is typically used first and second line, including, for example, if a patient doesn't adhere due to any psychological impact or anything like that. We even have the IV alteplase, for example, stocked up in hospital so that we don't have any of that loss as well, so that there's no delay in any patient treatment. Not only for Mr. Ali, but for all stroke patients that are here.
Adding to what my colleague has said, I think it's important to monitor the treatment in terms of overdoses. So a medication count would be also important, because in harsh times, the patient could notice that the medication is not giving him any benefit. He could attempt suicide. So for that reason, it's important to keep monitoring over the treatment and the number of doses given to him.
Also, as an interprofessional team, we would work alongside with the case managers, social workers and home healthcare services to ensure that all the necessary equipment will be within the household as well. But also for the psychological impact of the catastrophe, we would ensure that hotlines for not only Mr. Ali, but also for caregivers of stroke patients like Mrs. Fatima, that there are caregiver hotlines as well that are available, like Doa Mums caregiver hotline, and also other hotlines that can give support stroke. Do you have anything to add, anyone?
And can I add something? Okay. So also from the occupational therapy aspect, they should work together and make sure that the patient is fully healthy, so he can, because he was worried that he can't work, so they must prepare him to get back to work and be healthy. That's it.
Thank you so much.
Thank you, Group 3. Thank you, Group 2, sorry. And now we move to judges' feedback. Dr. Ahmed.
Wow with a capital W and a capital O and a capital W. So what went well? I'm just going to focus on one area. I love how culturally considerate you were. You asked if the patient and or his spouse want an interpreter. You also addressed the shame and the stigma. And we know, I mean, this is my research. I've been conducting research now on stigma for the last 15 years, and it's a major issue in the region. So that was fantastic. Even better if to plant the seeds of hope. So important. And for example, I think he may have been catastrophizing, which we know is a negative automatic thought. I'll never recover, I won't be able to find work. So you kind of touched on that. But just to reiterate, if you can plant those seeds of hope, I mean, the importance of that cannot be overstated. And it's just a technical kind of issue. I thought it was really good how you had clear clarification of the roles in your video. But then when you were kind of speaking in person, it was out of sync. So that's just something to take into consideration. But otherwise, no, congratulations. Well done.
Thank you.
Thank you so much. Very creative group, actually, and I like, you know, your culture is sensitive, and that's excellent. I like very much, you know, the way that you communicate together and collaborate together, and, you know, looking at everybody, and giving, you know, a stage for everybody, understanding the patient, you know, and the wife needs. So I think, you know, you've done beyond, you know, what you're doing. And I hope when you are in real life, you do the same. Thank you.
Thank you so
Thank
much,
you.
doctor.
Well, you certainly worked hard at trying to understand what each other does in an event like this, and that was very apparent, so well done. The introduction was fabulous because it helped me to understand the problem that you were going to be talking about. I agree with my colleagues, your kind of social attention. It's so important to ask questions about the determinants of this rather than just looking at what comes into it. So worrying about, will the patient go home to a place where somebody in the community is going to support the family, et cetera. You articulated that very clearly. And I was very pleased when you came out of the huddle to see that you were actually kind of going back and forth between each other about how to respond to the questions. So great. My colleague said wow, so I'll say wow.
Thank you.
Thank you. I think you did excellent. The role play was really good because you really expressed yourself with a different discipline. I think it was excellent. Thank you very much. Thank you.
Thank you so much.
Thank you so much.
Thank you so much, Group 2. Thank you so much. Now I think it's Group 3. Can you please head to the stage?
We present our patient, Mr. Ali, and this is his care sheet. This is his summary. And what you're seeing here is a bad example of a multidisciplinary team and bad patient-centered care.
What's this? I can't understand anything. How am I supposed to know everything?
Okay, so now my team will showcase a good multidisciplinary team and a good patient-centered care. Okay, good afternoon, Mr. Ali and Mrs. Fatima.
Good afternoon.
Thank you for coming to your meeting. Let's sit down. What language would you prefer the meeting to be in?
I'm English teacher, so English is fine.
Okay, so me and my team, we had a meeting and we looked at evidence-based practice and we formulated a care plan for you. So is there any questions or anything?
Please. I don't understand anything. I'm confused. What I'm going to do?
Okay, so what we'll do now is we'll invite the doctor who can explain more to you.
Hello, Mr. Ali. Hello, Mrs. Fatima. My name's Nawal. Before discussing your treatment, I just want to check your understanding of stroke.
No.
You don't have any? Yeah, I can explain. A stroke is essentially when there's a lack of oxygen in the brain, and it can be caused by a traffic jam of your blood vessels. I want to reassure you that recovery is possible, and you're in the right place to get the support, and we will guide you on your way.
Okay, perfect. Thank you.
Right, thank you.
I hope that gave you great understanding, both of you. And now what we'll do is you've had a great change in your medications.
Yeah, I don't understand what's going on in my medication.
So the
It's all
pharmacist
changed.
will talk more.
Hi, I'm Aisha. Is there any particular drug that you're worried about?
Yeah, you added fluoxetine and it works. It takes too long to work.
Yes, it does take about 4 weeks to work, but don't stop the medication as you can experience withdrawal symptoms. Anything else?
Why does my husband have to take atorvastatin at night?
It's for cholesterol, so cholesterol is mostly produced in the night, so it'll be more effective to take in the night. Anything else?
Yeah, thank you. But
So here's some more medication guidance, and I heard that you're also smoking quite a lot, so would you be available for some smoking sessions?
yeah, smoking. I might try.
Okay, yeah, that's fine. Thank you.
Thank you.
Okay, thank you. And I'm hearing you're having a bit of difficulty regarding your diet.
Yeah, I can't change my diet. I'm sorry. I like my
Okay.
diet.
So we have a dietitian on the team who can tell you more about how you can maintain a balanced diet.
Hello, I am Diana. Can you tell me a bit about your diet, please?
Yeah, I like Egyptian food, and my wife is cooking amazing Egyptian food, koshari, so I can't change it.
Okay, at the moment your diet is a bit high in carbohydrates, which gets broken down quickly and your blood sugar raises quickly. What you can do is eat it cold or reheat it so that it's absorbed slowly.
Okay, perfect. This is good. This worked for us, right? Okay.
Thank you.
I hope that helped both of your understanding. And now we'll have a nurse come in and talk to you.
Hi, I'm Akane. I'm nurse, and I take your vitals. Did you sleep well?
Yeah, I slept well.
That's right. However, your tongue is better than yesterday. Were you able to eat your meal?
Yeah, my tongue is, I'm feeling it's better and I can taste now.
That's excellent. This is proof that you are recovering. What are you planning to do today?
I don't plan to do anything. I'm tired.
Is that so? There are days like that. If you don't mind, you can talk to your wife and daughters, and we are here to help you.
Okay, thank you. I'll talk with
Thank
them.
you.
Okay, from my understanding, you haven't been attending your physical therapy sessions?
No, I don't attend. I don't want to go to hospital for physiotherapy.
Okay, we have a physiotherapist. Would you be willing to speak to them and
Yeah,
find something
okay.
that works?
Why not?
Hello, Mr. Ali and Mrs. Halima. I'm Ryota.
I don't want to attend physiotherapist session in hospitals.
Okay, Mr. Ali, if you don't want to go to the hospital too much, I can create a program that you can do at home with help from occupational and speech therapists.
Yes, perfect. Thank you. We can work on this in home, yeah. Thank you.
Let's work on it with the help of Mrs. Fatima and your daughters.
Yes, I will meet with them. Thank you.
You're welcome.
Okay, I found out from your wife and your daughters that your mental health has been declining. Would you be open to speak to a psychiatrist?
I might speak, but I will never book an appointment with her.
Hi, my name is Lina. So,
Hi.
mental health can be impacted by stroke just like physical health. It's very common that you feel depressed as a reaction to your stroke. A lot of people do. I can offer you regular meetings and we can talk and try to improve your mood and motivation for rehabilitation.
I'm not crazy. I'm hopeless.
I know it's all a lot, but it's not about craziness, but to adapt to your big life changes you had. We can, of course, take your opinions in consideration, and it's all up to you. So if you want to do some changes, we could arrange, for example, online sessions or give you some spiritual guidance if you want
Yes,
to.
online session as tip is good. Yeah.
All right,
Let's have
thank
one
you.
session. Thank you.
Okay, and as the case manager, I wanted to inform you, we have referred your case onto a social worker and they will contact you because I can understand there's been a lot of strain on you. And I do have to recommend you attend your regular dental checkups, please. Thank you for coming in today.
Thank you. This was very helpful.
So Mr. Ali went home and carried on as with the care plan discussed by the team and Mr. Ali, and it helped his better his health.
This is a fast tool for the identification of stroke. And just a final quote to remind us that God's guidance and support are always available to us. But in order to bring about positive changes in our lives, we must take the initiative to transform ourselves from within. Thank you.
2 months following discharge, Mr. Ali case deteriorated, and his wife called you to tell you that she is not able to keep providing her husband with support to carry out daily activities and take the medications. She can't hire any specialized nurse to help her and to assist her husband. She added that she has to get back to work, and now her husband will spend most of the day alone. How do you address this?
So first get a translator because she doesn't speak English. She does.
We can refer her to here, Qatar. There is societies that help in this.
If she wants support from her workplace, she can contact occupational health.
Are there any like voluntary helpers around? Voluntary helpers?
Voluntary helpers, yeah, in Qatar.
Support groups?
We also have nurses that can go from the hospital.
Yeah, but she don't want to hire anyone.
No,
So
but
then
not private nurse, like, part of the hospital to provide care.
So I guess just talk about occupational health, how she can talk to her employees and ask if she can make any adjustments at work. She has more time for her husband.
From us, we can discuss with the social worker if we can provide voluntary visits.
And we'll ask her to keep that good communication with the social worker.
Yeah.
So who's speaking?
Like psychological help for the wife as well?
Yeah.
Support for
Support groups, where they should meet other families going through the same thing as well.
So support groups.
No, I think we go and if somebody, if you miss
Level and level. Okay, so we'll start.
So I'll start with the support groups, social worker, and good communication with the social worker. And
I can talk about occupational health.
Occupational. Then we can talk about here in Qatar there is societies to help and provide voluntary visits.
Yep.
maybe ask the family, like
ask,
the children, to come and support her. I don't know.
Yeah, we can offer this. Offer this.
Yeah.
Okay. So wait, 1, 2, 3.
Unfortunately,
if anyone wants to talk, they can talk as well, obviously, 100%. If we miss anything. Okay. Okay, so what we would do is we would tell them about support groups that they can talk to, and it will be people that's going through the same situation, and it can give insights to how to deal with it. And the next thing we'll do is we'll follow up with the social worker and see what can be done to speed up the process from our end. And we'll ask the family to have more of an open communication with the social worker and let them know about any updates in the situation.
We would always also advise her to speak to her employees and on occupational health, whether there's any adjustments that can be made at her workplace, where she can have more time to support her husband.
Also, we can collaborate with the hospitals and here in Qatar, the societies that can provide a voluntary visits for this patient to help him and help the wife.
And we can also suggest her talking to other friends and family and seeing if they can offer some sort of support, even if it's not coming to take care, just having someone to talk to and express their emotions, it does help a great deal.
Or just at the last point, offer her some psychological help or any other like family members, because it's really stressful for her as well. Okay, thank you very much.
Thank you.
Thank you so much. Group number 3. Dr. Ruwaida, you wish to start the feedback?
Thank you so much. You've done well, but I haven't seen much of the group dynamic in the beginning. So you brought one after one. Sometimes you need maybe more. Sometimes you might not start with everybody, but at least 2, 3, 4 together. Then you add up. So the group dynamic, the collaboration and communication with each other, I think, next time it needs, I think, more work in this area. So thank you.
So well done. It's not easy. We'll start off with what went well. I'll focus on the kind of mental health aspect. I thought, the psychiatrist, I thought your tone was very calming and very soothing. I love how you equated mental health with physical health. And I think it would be even better if you perhaps may explore, well, perhaps comment on the stigma that is rampant in the region and invite the patient, ask them the question, is this something that you feel is something to be ashamed about, for example, and then say with conviction, this is absolutely nothing to be ashamed about. And then I like how you framed it. Yeah. But I would perhaps try to normalize it even more by saying, look, let's just meet up and have a chat. Let's just talk. Yeah. Let's talk about how you're feeling. And then maybe even add, if we improve your mental health, we know that it will improve your physical health. And if we improve your physical health, that will also improve your mental health. But to reiterate, to emphasize, loved your tone, very calming, very soothing. And also the passage from the Quran as well, which I think given where we are, the region, that was very powerful too. So well done, well done.
Well, as the kind of patient I wouldn't want to come across, actually. He's pretty good. I felt that you were kind of stiff. It was like, this is hard work. And listening and watching your interaction with the patient, I didn't feel that you really calmed him down. He was quite aggressive and continued to be aggressive in his responses, which is probably natural under the circumstances. But I think there needed to be more kind of calming of the discussion, because under those circumstances, quite often the patient just doesn't take in what it is you're telling them, which is really helpful. You all had I thought, really good ideas. And after the huddle, I thought, you came up with a pretty good plan for how to follow them up, but you need to unlax, You're working with somebody who's had a problem. You just have to feel comfortable. Anyway, thanks. Good.
Thank you.
Thank you.
Thank you very much. I have two observations. One of them, that you focused more on the patient going home, like discharge phase, and you didn't look at more onto the acute phase of the patient, more on the discharge phase rehabilitation. So because the patient came by ambulance to emergency, so that phase, it took, because he was in the hospital for some time, so that phase was very important. And the reason why we have multidisciplinary team, because they have to communicate together and work together to put a plan for the patient care. So when each one came and talked to the patient, That's individual. It's not a multidisciplinary team because you have to agree together how you are managing the case. So that was very important, that observation, that you have to work together.
Can I comment on this?
Yes.
Yeah, because of the time, we have only 5 minutes. That's why we presented a picture of us having a team-based, evidence-based practice meeting. It's on the first slide. And then while we are discussing with the patient, they were out on the side discussing with each other what they are agreeing on. So here, we don't want to overwhelm the patient with a lot of groups saying a lot of information at one time. The patient will be lost. As in I'm in the shoes of the patient. If a group of people coming to me, giving me information, I'll be lost. That's why we try to arrange it. But as a multidisciplinary team working together, we had the meeting and they were discussing before getting to the patient.
Yeah, because that I didn't see, because even the patient communication back to you, only the individual is listening to that communication. It's not as a group, you listen to that communication back, the feedback from the patient and his wife. That it goes to all of you, not individually. Okay? Thank you.
Thank you.
Thank you so much, group number 3.
Thank you, guys.
Thank you. You did a great job. I would like to ask group number 4, please, and it's the last group for today.
تعالي she's gonna come تعالي تعالي keep the mic with you. Okay, we're gonna give you a mic. Just keep it with you.
Okay, panicked. I'm panicked. Okay, sure.
Keep listening for
Mrs. Fatma.
Mr. Ali.
Yeah, here. It's here. It's here. And the chair.
حلو ما تضحكني أرجوك.
Has everyone else? We didn't read it. Do we need? Is anyone?
إيه؟ Guys.
ساعدوني ساعدوني. Yes.
Hello, Mr. Ali and Mrs. Fatima. I'm the nurse. I'll be helping you today. So, how are you today?
I'm panicked. Mr. Ali is not feeling well, and I don't know what to do.
Don't worry, I checked his vital signs and they're all stable. Me and the team will discuss Mr. Ali's case and we'll find a treatment for him. Is that okay with you?
Yes, sure.
Hello, Ms. Fatima. I'm your doctor for today. We are all here together to help you. I've discussed your case and Ms. Ali's case with our team. I discussed with the radiologist as well as the cardiologist and endocrinologist. And the radiologist specified that Mr. Ali's CT indicates that he has a stroke. That is shown here.
Why has this happened?
Well, actually, a stroke is a decreased blood flow to the brain, and it could be due to the incompliance to the medications sometimes. Maybe he wasn't sticking to his medications. And also, we have some test results that have come through today. Would you like to discuss them?
Yes, sure.
This can be done by the help of our biomedical scientists.
Hello, Ms. Fatima and Mr. Ali. So the results, some of them were normal. However, your cholesterol and your blood sugar were quite high. This does need to be maintained. Is that okay?
A huge part of the Egyptian culture is about bread. How can we stop that?
So in that regard, my nutritionist will talk to you. But for the time being, to help with your cholesterol and blood sugar, my pharmacist will speak to you.
Perfect. Thank you. So to manage your blood sugar levels, Mr. Ali, I'm going to suggest you take metformin. This is affordable. So I know you have a lot of medications to comply with. For this case, I'm going to give you a pill container, which I have organized your medications to make it easier. I'm now going to pass over to the nutrition and dietist who will help explain further.
Thank you. As a dietitian, I emphasize on nutrient-rich food. So cutting bread at the beginning can be a good start.
Okay.
So are you okay with cutting bread? Because in Egyptian culture, it's really common.
We'll try our best.
Okay, I can give you a replacement, which is pita bread, a whole grain pita bread, which is readily available in every supermarket in Qatar. Now I hand it to the dentist who can help you.
Yeah, sure, I agree. Also, please try using some mouthwash and keeping hydrated. Also, please considering stopping smoking as this will improve your oral health. And please make sure to come regularly to your follow-ups.
This sounds good. And also, Mr. Ali, when I examined you, I found that you have a right-sided weakness as well as mobility issues. Maybe our physiotherapist can help you with that.
Yes, we will start with walking exercises, then gradually increasing what you can do together. We will also discuss occupational therapy and speech therapy for you to get back to work again.
I'm still worried. Mr. Ali is not speaking, and I have noticed rough skin on his feet.
Well, I understand that. To address that, I'll refer him to speech as well as language therapists, and we'll also refer him to a podiatrist to check on his leg, on his foot. If you have any other concerns, just come to us and don't hesitate. We will do our best to help you. Hello, Mr. Ali. Welcome to your follow-up visit. How's everything going?
He still refuses to talk and go out. This is not like him.
I understand. Maybe you could use the help of our psychologist in that matter.
Post-stroke depression is frequent in stroke patients, but we can assist. Conjunctive behavioral therapy is useful for alleviating depression symptoms combined with medications.
Absolutely. We have to combine medication alongside CBT, which is cognitive behavioral therapy, because this will be the most effective thing for you, Mr. Ali. Is this okay?
It's not okay. Medications are pointless.
We have to start on a low dose because this will ensure that he can comply, and then we'll increase it to a higher dose. Is that okay?
Okay, sure.
What about you, Mrs. Fatima? How have you been feeling?
I'm actually overwhelmed. I don't know what to do.
You're a strong woman. You can get through this. Let me pass you over to the social worker who will help you.
So, Ms. Fatima, I hear you, and I wanted to discuss the possibility of perhaps arranging a home care nurse, and we can also look for some support for you. Does that sound okay?
I'm actually afraid of getting a stroke, and how can I prevent it?
That's fine, Ms. Fatima. I'll pass you on to my public health professional, and they'll help you in this matter.
You can look at incorporating a healthy diet and exercise to reduce the risk of stroke. For Mr. Ali, he can join a support group to help him quit smoking and reduce his weight. The support group will also help him interact with other people and to divert his mind. What do you think, Ms. Fatima?
Okay, sure, thank you.
All together, we can be better. Thank you. So, 2 weeks following the discharge, Mr. Ali's case deteriorated and he became seriously depressed. His wife told you that he wrote his will and started to have some suicidal thoughts. How would you address this?
Like in England, they use like those helplines, like Mind and things like that.
Wait, first of all, we have to evaluate him by the psychiatrist, and then upon that, we can recommend the best plan. We also, if the patient, we can also involve the family in it, so that he can comply more and have more like.
You can talk. Support groups.
About evaluating? You mentioned evaluating. Yeah, evaluating psychiatrist.
Support groups charity helplines and make sure that changes environment to like kind of. I think it's encourage him to express himself. Yes, and you continue. Whatever you remember. Maybe like diet as well, because sometimes if you have too many carbohydrates, it can make you feel lazy. So like yeah, that kind of thing. Okay. So but psychiatry is the main thing though. Psychiatry and support groups.
And also support groups also involve his
According to not forget to mention Mrs. Fatima's feelings, and we've kind of already condoned them and we've consented with her, and to just keep making sure that Mrs. Fatima is involved. Yeah, involved, because she is just as important.
psychiatrist. What else? Okay. So to address the issue, which is having increased depression and suicidal thoughts, we actually prefer to refer him to the psychiatrist first to evaluate the case and the extent of the problem. During the process to improve that, we can consult several professionals on the matter, and also we might include behavioral therapy as well as support groups. We can also involve the family if this makes the patient feel better, because the mental health effect on one person can affect the whole family as well.
Especially Mrs. Fatima, as you can see within our act, we try to include her as much as possible, and this has definitely affected the way that she has seen and adapted to this whole chronic conditions that Mr. Ali has, and we don't want Mrs. Fatima to feel any burden, and when mental health comes into tact, we address that within our act, and we will continue to support Mrs. Fatima and both Mr. Ali. Yes.
I also think that the religious aspect, so maybe praying can help him express his emotions and connect with God, and that can help him release his stress and burden, as well as diet, because excess carbohydrates can also make you feel lethargic and fatigued. So maybe having a balanced diet, including more vegetables and fruits, he'll feel more active.
Absolutely, and none of this can happen without any medical professionals. We need everyone in our team, in our group, within IPN itself to collaborate and to become one and a union so we can help our patients and provide them with best patient care. Thank you.
Yes, sure, doctor. You can start. Doctor.
So, well done.
Thank
well
you.
done. What's palpable is there is a bond between the team members. I love how you emphasized on lifestyle and how that can contribute to improved health outcomes. It would be even better if, I don't think anyone actually started with addressing the patient directly himself. So even if he is unable to speak, ask him, are you able to speak? Do you understand? Would you prefer it if we spoke with your spouse, or because you were unable to articulate yourself, I'll speak with your spouse if that's okay? So it would be even better if you did that.
Yes.
But to, go on, yep.
Yeah. Sorry, we did that in the beginning. We asked the patient, hello, are you able to speak in, are you comfortable in speaking in English? But the mic was not working in the beginning. That's why it was not here. It was sent by the nurse as the first point when we bring the patient. So she told the patient, hello, are you comfortable in speaking to us with English? So we tried to address the patient.
I think, no, okay, thank you for mentioning that. So, I mean, maybe there's a language barrier is one thing, but first of all, then move on to, are you able to speak, and are you able to, can you understand what, look at the patient. It didn't really, because it felt like people were just focusing on the wife, which is important, but this is patient-centered care. I don't want to dwell on that, because this was excellent. It was an excellent team effort. And yeah, there were many other things as well, but I'll hand the microphone to my colleagues. So well done, well done.
Yeah, I totally agree with you, because, you know, even if he's not speaking, still when you talk to the mother also, you know, look at the patient, you know, because he's the center of, you know, what you're doing. The wife is very important, the children very important, but he has to be supported, you know, and this might help him actually, and maybe a little bit, even the eye contact is very important. But
That
you know,
is-
you've done really well. Thank
That is
you.
actually a really valid point, and we tried to include Mr. Ali within our discussion. But to represent the case, since he's having stroke, we had him just like gesture instead of speaking, because he has a problem with speaking, as like mentioned by Ms. Fatima, and that's why we tried to like communicate with him using signs, and had Ms. Fatima speak more about that.
Yeah, we agree with you, but we tried to abide to the case and what the case says. So the stroke was something that we needed to consider. So he cannot speak well due to that.
Yep, so, you know, it doesn't matter what kind of stroke you have. There is comprehension. And I agree with my colleague, you know, you should have tried to see whether or not he could do this or this, just to see how much comprehension he has, because it's a sign of respect for the patient. And I know that you all respect the patient, but the patient needs to know that out there, outside of this captured brain, which is what happens when you have a stroke, you know, there are people who do understand that something is happening in here. So that said, just kind of think a little more or read a little more about what stroke patients of either side continue to understand. And we know from the data that comprehension in the 1 month that you went back, which was great, his comprehension would have gone like this. So that's why you need to talk to him as well as talk to his wife, because the wife will have noticed that that comprehension was improving, and that gives you more basis for doing the behavioral therapy, which you will want to do. And I think from my experience that it helps with this terrible, terrible feeling of just wanting to do away with yourself. Having said all of that, great team effort. You actually looked at each other. Fantastic. I think you should have been a little better about your time management, but that's the way life is. And you clearly were trying to teach each other about what you know. You know, that's the interprofessional piece, you know, learning with, from, and about each other. So being clear, no acronyms, thank heavens. You know, acronyms are going to be the death of the healthcare system.
Yes,
so no acronyms, that was great. And I thought your language was relatively clear, but when you talk to other members of the team that really haven't worked with you before, you have to scale it down, you know? No polysyllabic words, and no, you know, secret language of the pharmacist.
Yes.
So I had a feeling you were trying to get there, which is great, because with, from, and about, for the purposes of collaboration, to improve the quality of care. Thank you. Great
Yes,
stuff.
thank you.
I think generally you did very well. I liked your group dynamic, but as my colleague also, the communication was a bit an issue, especially with the patient. I always believe that even if the patient is unconscious, they can hear us. So it's very important to always to think that you think sometimes they're not hearing you. I think they do. And I have this experience myself on personal level. So this is why communication is very important to the patients, to each other, and to the wife is important. Thank you.
Thank you.
Thank you so much.
Thank you.
Thank you so much, Group 4. Can we all please clap our hands for the amazing presentations? A lot to learn. I'm sure that everybody learned something from this experience. And by that, we conclude the Interprofessional Case Challenge. The announcement of the winners will be at the closing ceremony, so please come join us later. I will hand now everything to Dr. Suhad.